Hi, my name is Ed Smith, and I'm a pediatric neurosurgeon at Boston Children's Hospital. We are very excited to be partnering with the Brain Aneurysm Foundation today on this Global Day of Engagement around aneurysms. And I am very pleased to be introducing my colleague, Dr. Alfred See, who will speak to you a little bit about the very important, unique aspects of pediatric aneurysms, discussing how they are different than aneurysms in adults, and hopefully some of the exciting advances in the field that we are excited to look at in ways that may be able to help children going forward. So without further ado, Dr. Alfred See.
Hello, my name is Alfred, and I'm one of the neurosurgeons at Boston Children's Hospital, specializing at the Cerebrovascular Surgery and Intervention Center. With Dr. Edward Smith and Dr. Darren Orbach, the group of us are excited to be participating in the Global Day of Engagement coordinated by the Brain Aneurysm Foundation. In particular, we obviously have an interest in advocating for children who have brain aneurysms to improve their care and diagnosis. When we're thinking about brain aneurysms in children, one of the first and foremost questions is certainly how common are they? Brain aneurysms can present both in an unruptured state or in a ruptured state, but in children, it's relatively uncommon. And as an overall part of brain aneurysms, children comprise a very small portion. For unruptured aneurysms, we like to talk about 1 in 50, or approximately 2 to 3% for adults. And that's the vast majority of brain aneurysms. Only 0.5% to a few percent of all brain aneurysms actually occur in children, whereas the rest of them occur in adults. It's a similar story for ruptured aneurysms, where only about 0.5% of ruptured aneurysms are occurring in children. That means that overall, in a given year, it may be about 100 or so brain aneurysms that present with rupture in children. This is not a large number, but it's still impactful for every single one of those patients. And we can go through in the next few slides how we might be approaching reducing this number and preventing this problem from happening. Before we proceed there, let's think about how brain aneurysms are different in children. It's different in a number of ways fundamentally in terms of how they present. First of all, they happen more frequently in boys than they do in girls, which is different than in adults, where women are much more likely to have brain aneurysms than men are. Second, children have aneurysms in different locations than adults. So first, there's a territory of blood vessels that supply the brain called the posterior circulation. About a quarter of brain aneurysms in children occur in this area, compared to only about 1 in 12. In adults, it's much more common to have aneurysms in the anterior circulation, and that's actually much less common in children. In certain specific regions of these territories, they can have similar amounts of aneurysms, but the distribution overall can be a little bit different. And this, combined with the gender differences and combined with the reasons, suggests that brain aneurysms are probably behaving differently in children and may need a different kind of attention than they do in adults. We do know that brain aneurysms are less likely to occur in multiples, so meaning different sites in one patient in children than they are in adults. Adults are more likely to have multiple brain aneurysms, but children are quite a bit more likely to have a large brain aneurysm when it is found, so greater than 2.5 centimeters, which is about the size of your eyeball. And that's a fairly large aneurysm that is potentially very concerning and at a high risk of causing problems. And finally, we think that brain aneurysms probably form for different reasons at different ages. In the adult literature, there have been a lot of studies figuring out all the different places where the body goes wrong, whether it's the cells or how the flow is interacting with the cells. But in children, if we look at the right-hand side of the slide here, one way that it can be different is this may be congenital or from birth or from the way that the vessels are forming in the first place. So we see some aneurysms in very young children that we think are probably there from how the blood vessel developed originally. Second, sometimes brain aneurysms in children actually occur from a severe trauma. And this is known to occur in adults, but is much less common. In children, up to 1 in 4 of the brain aneurysms we see are likely the result of trauma. and also relating to kind of a new injury to the blood vessel that's a single discrete event. Infection can also cause injury in the blood vessel and cause an aneurysm. This is overall different from adults, where we think many of the brain aneurysms we see and take care of in adults are the result of wear and tear over many decades in a gradual fashion. Again, in contrast with a specific trauma event or a specific severe infection causing it in children. This has been studied in children, and we see here some circle pie graphs on the left-hand side showing that even over the first 10 years to the second 10 years of life, there are differences in what type of aneurysms and what the reasons for those aneurysms to form are. We know that younger children have a higher rate of aneurysms that involve all of the vessel wall, 360 degrees around that vessel, than slightly older children. And older children start to have aneurysms that look more like the typical aneurysms we see in adults, which are in outpouching. But it is an important factor that aneurysms that run in families are a significant contribution to aneurysms in children. And it's about 5 to 20% of cases in all children and young adults, although it tends to occur in that second decade of life. And it's a little bit less common to run in families for those really, really young patients that are pre-pubertal. So now we've talked about how aneurysms are different in children compared to adults. So how do we end up finding aneurysms? Really, this is a common question that I'm asked by doctors and patients and their families. It's really about testing and screening. So we do have some nice guideline information that's been reviewed by the whole team of physicians and experts in the field, including Dr. Smith, one of our partners at Boston Children's Hospital. And this is work done in coordination with the American Heart and American Stroke Associations. This is recent information and recent consensus agreements looking at the literature from 2019, only a few years ago. And that guideline would be that in patients who have 2 first-degree relatives, so parents, siblings, and children, then it's sensible and worthwhile to do screening imaging for them. That being said, guidelines are made to incorporate all the information and think about the population as a whole. So we might want to take a closer look at some of the information that led to some of these guidelines being formed and think through some complex cases that may come up and are tricky or maybe are difficult to formulate in the context of these kinds of rules of 2 first-degree relatives. So if we look at some of the older data that led to some of these guidelines, people looked at families that had aneurysms running in them and looked at the risk compared to people who have no evidence of family history of aneurysms. So this group, familial intracranial aneurysm investigators, looked at families that have 2 siblings, so first-degree relatives that have aneurysms, or if they're more separated, then more than 3 family members. And in that group, they found up to 1 in 5. So not the number that we're typically quoting for every person that we may encounter, 1 in 50, but 1 in 5 of these families, 1 in 5 of these people have brain aneurysms when they were studied with an MRA. So that's a significant increase. And again, this is in families where they have multiple family members with brain aneurysms, 2 siblings or 3 or more affected family members. It is interesting, though, that there were 90% of these people who previously smoked. So that's not going to be something we see in children. And most of these were women. So again, this tells us that these are mostly adults. And this is not exactly what we're encountering when we're talking about a child who has a question of should this person get an image to check for brain aneurysms. Many of these aneurysms were treated. 1 in 5 of them were treated after that kind of diagnosis. So that's one study that kind of formulated some of the reasons. It's a very high rate if you have multiple family members or 2 first-degree relatives. If we break that down and compare it to the general population, we know that the general population has probably got 1 in 50. If we look at these families, 2 or more first-degree relatives, that risk is increasing by about 4 or 5-fold, right? If we look at families that don't have multiple members, that don't have multiple first-degree relatives, that risk is maybe a little bit increased, but not nearly as dramatically. So maybe about twofold. And this is a reasonably sized study. So this is some of the information that led to that guideline statement. If we then look again at a different study that kind of reaches a similar result, just similar data, or similar interpretation ultimately, this looks at people who pass away from unknown reasons. They did autopsies and they found, again, that number that we like to discuss in the Brain Aneurysm Foundation. About 1 in 50 people have a brain aneurysm, potentially without even knowing about it. And then if there's one family member with a brain aneurysm, that risk of having an aneurysm increases slightly. So maybe about 2 times that much, so about 4%. And then if there's multiple family members who have brain aneurysms, that increases somewhere to that 10 to 20% range, or 1 in 10 to 1 in 5. So again, those are the people that really have a strong reason to have screening imaging. If we then think about, well, how's it different from adults to kids? And is it different if it's a sister or a brother versus a child or a parent? We do have some data on that as well. So this one group looked at that and found that if they compared the risk of having an aneurysm in the children of those patients versus the siblings of those patients, that risk is really occurring in the siblings much more so than in the children. Part of that is potentially age contribution. We see that older people who get that screening test start to have a higher risk of those aneurysms. So people older than 60 who have a family member who had an aneurysm are going to have a 6 times risk compared to people who are under 30 years old. So when we're looking at children who have family members who had an aneurysm, we're much less likely to find an aneurysm in them than the siblings of that patient or older adult family members of that patient. Another recent study published out of Thailand kind of suggested the same kind of pattern. So children of a family member who have aneurysms, they have a slightly higher than typical risk of having a brain aneurysm, but it's not nearly as high as the siblings. So 16% of siblings may have a brain aneurysm. So again, that 10 to 20% range versus the 5 to 10% range for kids. So there is a little bit of an increase when you have family members who have brain aneurysms, but really that risk is borne mostly by the siblings and the adult relatives rather than the children in that family. If we look at how that relates again to the number of first-degree relatives, we saw that in that early study where there's maybe a doubling of that risk in families that have one person, and then 4 or 5-fold increase in that risk when you have multiple family members. And we see another study that kind of shows that same pattern. So in this case, they're looking specifically not just at the aneurysms, but the risk of having a bleed. So if you have no family members with bleed from an aneurysm, just the kind of general population, there's maybe a 0.5% risk of having an aneurysm bleed in your lifetime. If you have one family member, that risk does go up a little bit to a few percent, but it's really the 2 or more direct family members, first-degree relatives, where you start to have a significant increase of having an aneurysm and having that aneurysm bleed at some point in your life. That being said, all this data is interpreted in the context of where we are in terms of treatments, how good our imaging is, and that's always changing. So some of those data were back from the 90s and the early 2000s. And now, based on some changes in how we can treat aneurysms nowadays, safer than what we maybe used to be able to, groups are continuing to do cost effectiveness and safety analysis to think through where it might be appropriate. So ultimately, in any patient situation, it's worth talking with a doctor and a specialist who sees aneurysms a lot and potentially sees children with aneurysm to think through how this case might be different or unique and how it might be appropriate to design a screening protocol. It's also important to understand that getting a picture once may not answer the question of is there an aneurysm for the rest of the person's life. So we need to think through what is an appropriate and effective way of doing that on a case-by-case basis. If we find an aneurysm, what do we do about it? Unfortunately, in children, many diseases aren't studied directly in a patient or children because, for example, in aneurysms, it's extremely rare. That being said, we are able to apply a number of different treatments, but in children, we certainly want to make sure that we're thinking through each case in a very comprehensive fashion. That means we bring in a number of specialist experts. So that means neurosurgeons, neurointerventionists, who may be radiologists or maybe neurologists or maybe neurosurgeons who do minimally invasive techniques, and also stroke neurology. So dedicated neurologists who specialize in the care of children who have abnormality of the blood vessels of the brain. These are some figures that show some of the ways that we can treat them, and we'll go through some of them. It's always important to remember that just because there's the availability of a procedure doesn't mean that that's the right option for a patient. So sometimes we just need to make sure that the entire body is optimized and all the blood vessels in the body are optimized. So sometimes medications to treat that might be the right step. If a surgery is required and it's favorable and safer to do the surgery than to have the aneurysm managed with medications, then we have a number of different strategies to reconstruct the blood vessels or block the aneurysm out of the blood vessel supply so that it's not at risk of bleeding for the patient in the future. Sometimes we need to block that entire vessel if the disease is involving the entire vessel wall 360 degrees around. And in that case, we may need to provide new blood flow to the vessels. Expert centers are able to provide all of these kinds of options. I show a picture here of an intraoperative view. So this is under the microscope. We have these titanium clips, and we see this little bleb outpouching the blood vessel. And these clips isolated that, so it separates that, and that blood vessel that's down here is a normal segment, is no longer circulating blood into the aneurysm. So that aneurysm is no longer at risk of bleeding. On the right-hand side, we see a picture that shows when we put indocyanine green, so this is the fluorescent dye, and as it circulates, we see where the blood flows, which is in this region. And here, we can't see the clips as well, but they're just above this region, and that little bleb of the aneurysm is no longer filling, again, demonstrating the effective treatment of this technique. Ultimately, there's always evolution, and more aneurysms are now treated by what's called an endovascular approach or a minimally invasive approach. So this involves different techniques and different devices that are changing year to year and decade to decade. But over the past 30 years, we've used devices to coil and block off the flow into the aneurysm. We've used devices to help us reshape the vessel so that we can get the coil to sit safely in aneurysms that were previously difficult to treat with endovascular approaches. And then finally, in the last 15 or so years, we've started using flow diverting stents, and these actually change the flow in the normal blood vessel so that it reduces the flow into the aneurysm and allows the body to gradually heal a new blood vessel wall on the inside of that stent and block that aneurysm from having any blood flow into it. Sometimes a stent may not be the best option, and we can use devices in the aneurysm that do that same technique. And ultimately, sometimes we need to close the vessel completely in order to block flow into the aneurysm. This is a picture showing a case where we use an endovascular approach. A patient came in with a bleed, and we see this little outpouching in this middle picture here. And then we do three-dimensional modeling of that aneurysm so we understand its shape and understand how it's relating to the other vessels. All of this is done under fluoroscopy, so under X-ray, and through minimally invasive approaches through a small tube from the blood vessel of the leg or the blood vessel of the wrist. Again, we see that aneurysm, and here we see a balloon that I use to shape the aneurysm and prevent the coils, which are inside the aneurysm, from falling out until we've got a nice construct that allows it to stay inside the aneurysm. And this is later on in that treatment, and we see the aneurysm is now blocked and no longer fills. There's a shadow of that part of the aneurysm that folds behind the artery, but we see the normal filling in the artery supplying the normal parts of the brain. This is a different type of treatment that I took care of for this patient who came in with headaches. And we see here on this left-hand picture, this outpouching that's fairly involved and extensive. And here I can't put coils that just fill that aneurysm without blocking this major blood vessel to the brain. So this is an example of a flow diverting stent. So I've outlined here in these red dashed lines where we've put a stent that reconstructs and protects that blood vessel and makes sure the flow flows through there into the normal brain. And then we were able to put coils into the aneurysm without them falling into that vessel. And here on the right-hand side, we see again where that stent was, and then where the coils sit to block off the aneurysm and reduce the flow into that. Over time, the body will heal a layer of cells on the surface of this stent, and that will be a permanent cure. Any center that specializes in blood vessel treatment is going to be able to coordinate a multidisciplinary discussion where specialists in all of these techniques can discuss each case and think through what the advantages and disadvantages of each technique. So that's an important part of the care of brain aneurysms in general, and certainly in the brain aneurysm care for children. What happens after the treatment? So ultimately, in children, lifelong follow-up is an important consideration. We know that people who have aneurysms don't always have them at birth, and we know that in many cases they can develop over time. So ultimately, most patients who have aneurysms or have a significant family risk need some sort of repeated follow-up over time, and that's something that needs to be discussed on a case-by-case basis with your doctor to pick exactly which type of image is the right balance of accuracy and the risk to find aneurysms for you in the future. And ultimately, certainly, any patient can reduce their risk of forming an aneurysm by avoiding smoking or stopping smoking if that's something that they're doing at that time. There's a lot of information in this discussion, but what are some of the take-home messages? I think the first thing is that age matters. So children are different than adults, not just in their size or their anatomy, but even the underlying reasons that they have aneurysms and how those aneurysms respond to any treatments. Screening is controversial and is a very common topic, but there are structured guidelines which are a good rule of thumb, and it's worth it to discuss with your neurosurgeon if it makes sense to screen other members of your family if that's a question that's come up because someone was found to have an aneurysm. And certainly if there's multiple family members, that's something you'll want to discuss with someone who specializes in brain aneurysm care for children. The treatment team is important because, as you saw, there's a number of different ways to treat any given aneurysm. And even within those types of strategies, there are nuances. So it's important to get a balanced perspective from neurologists, neurosurgeons, and radiologists to figure out what the best approach is for each specific case. And finally, follow-up is critical, whether that's the follow-up of the treatment of an aneurysm, but also preventing and detecting future aneurysms by avoiding smoking and getting some sort of repeat picture at an appropriate interval where the risk of that aneurysm is starting to increase again. Thank you so much for joining us today on this day of engagement, and I'm glad to be a part of this Brain Aneurysm Foundation working group.